Hi, good morning, everyone. This is Katie Chuba, the director from the Hartland Area Chamber of Commerce, coming to you today on May 7th, and this is our Zoom at noon. We are doing these programs every Tuesday and Thursday. Oh, John, you're sharing your screen. Can you stop sharing your screen for just a second?
Sorry about that.
No, that's okay. So we're just going to hang tight just for a minute. So we appreciate your patience as we let our attendees sign on. I have found why we do these Zooms at noon. If we just wait a couple minutes, everyone will join us. It is lunchtime too, so we'll see if people are running a little behind or not. So just to kind of give you all an update, we are doing these here at the Hartland Chamber every Tuesday and Thursday with industry experts as well as business leaders in our community to bring, hopefully, insight to you, tips and tricks, with what people are doing that is working for them with their business. Everyone's talking about the Back to Business plan. So we're hoping that these really bring some value to you as a business owner or someone that's really trying to conduct business in Livingston County. We've also had the privilege of collaborating with the Brighton and Howell Chambers of Commerce, as well as our local economic development, Ann Arbor Spark, our Livingston County Convention and Visitors Bureau. So we are collaborating with our partners too to bring more stuff like this to you guys, webinars and Zooms, and that you can take and use. And we really need to do what we can together with our partners to make sure that we kick back and getting our economy back to where we need it to be. Again, I want to thank you all for tuning in today and joining us for our Zoom at noon. And we have lots more to come, so make sure you check out our website. We have scheduled all the way up till June. So we have some really good Zooms at noon heading your way, and pick and choose what works for you. And we're only a phone call away here at the Chamber too. So today I'm really excited. I have the president of the Livingston and Brighton Hospital for St. Joe's, John O'Malley, is here with us today. So say hello, John.
Hello, John. That's an old joke.
Yeah, no, it's always a good one though. Hi, John. And also joining us today is an IHA doctor, Dr. Paulson, one of the partners with St. Joe's. So say hi, Dr. Paulson.
Hello, everyone. How are you today?
Oh, you didn't fall for that joke.
I didn't follow the trap.
Well, I appreciate both of you being on today. So it's really good to see your faces. And please, let's take turns and just kind of introduce ourselves and tell us how you're doing and what your background is. And we'll start with you, Mr. O'Malley.
Well, as Katie indicated, I'm John O'Malley, president of St. Joe Livingston Hospital and the Brighton Health Center. By way of background, I have held numerous positions in acute care with Temple University Health, with Ascension, with Select Medical for post-acute care, and now here with Trinity Health the last 3 years in this role. And I can tell you it's been very rewarding for me. I really enjoy working with the community and bringing services that the community may not have but really do need to the community. And I've had nothing but great support from St. Joe Mercy Health, Trinity Health, and IHA, who, as Katie indicated, Dr. Paulson is here from IHA, and they've been huge supporters of us and helping us accomplish those goals so that we could better serve the community. So it's been good.
Thank you so much. Appreciate it. Dr. Paulson, thank you again for joining us. Tell us a little bit about yourself.
All right. Well, I am the site medical director at Howell Primary Care. at Michigan and Highland Road out in Howell. And I've been that since September of last year. You was previously working at Brighton Family Care near the St. Joe's Brighton Center. I am a Michigan State graduate from the osteopathic medical school there. I did all of my training at McLaren Macomb. From there, I actually moved to the Thumb for 3 years, but once we had kids and realized that we needed family around, we moved back to South Lyon, where my wife is from, and I'm glad to be working in Howell. I'm glad to be back in civilization, and it's great working in Livingston County, and I mean, we're doing great things out there.
Yeah, for the record, you are in the best county of the state. So welcome back.
I don't disagree with that.
Oh, thanks, John. Well, I appreciate you. And, you know, I have to say, and everyone says it, but I have to say it too, you know, you guys are on the front lines. I can't even imagine. I have turned off social media when it comes to that stuff because it's a little racketing to my brain, and rather put my energy, instead of doing that, put my energy towards my family. But you guys are on the front line, so thank you for risking it all, I guess is a good way to say it, you know, so thank you. Now, John, I know people that are listening, I assume they want an update. They want an update on what's going on in our county, how does it affect the state. I'm just kind of throwing these at you off from the hip here. What are the latest statistics? What can we expect as a community as far as services go, and where we're headed? So I'm going to just turn it over to you.
Yeah, you know, those are great questions, Katie, and thank you for that. I do have a slide presentation here, so I will share that screen and go through it. And at the end, certainly open it up to questions. And I think Dr. Paulson at the end also has some comments he would like to make. And then I think together both of us can answer and address any questions or issues that the community you know, will bring up. So
yeah, I don't mean to interrupt you. I don't mean to interrupt you, but sorry.
No,
yeah,
okay.
you reminded me. So yeah, anyone out there that has a question, at the bottom of your screen, there's a Q&A. Go ahead and type your question, and I'd be happy to facilitate for that for you gentlemen today. So I agree with you. At the end, we'll leave some time for Q&A. I've also received a few emails on questions, and I have those ready for you guys as well. So yeah, so we'll hopefully leave about 15 minutes or so for some questions and stuff. So thank you. So go ahead and share.
I was going to say I may answer some of those questions in the presentation, so who knows?
Hopefully.
Okay, so let's see here. Let's see if I can.
Yeah, are you sharing your screen now, John? Yeah, perfect.
Okay.
Yes, that looks wonderful.
So everyone can see that?
Yes.
All right, great. So, you know, first of all, you know, I wanted to just thank Katie for inviting me to speak today. And, you know, it quite frankly, it's always a pleasure to speak to the Hartland Chamber of Commerce, as well as, you know, the entire Hartland community, whomever can be a part of this. You know, we are truly living in unprecedented times. And the past couple of months, I think, have been challenging for everyone, quite frankly. The COVID-19 situation is rapidly evolving. It seems, you know, there are new guidelines, recommendations, and processes daily, if not more frequently than that. Sometimes we find ourselves almost hourly making different decisions. So things are flowing heavily from CDC and our government. But we are definitely, as Trinity Health, as St. Joe Mercy Health, as IHA, and as obviously St. Joe Mercy Livingston and Brighton, on top of those communications. You know, St. Joe's, Livingston, and Brighton, you know, we have and continue to be ready to support our community through this pandemic and beyond. I'm going to touch a bit more on that later. But today I'm going to give you an update on COVID-19 and how it has impacted our community and how we are beginning to operate under what we call the new normal. Slide 2 here, Michigan has been one of the hardest hit states. I'm probably not telling you anything you don't know. As you can see in the map, Southeast Michigan, and in particular Wayne, Oakland, and Macomb counties have seen the highest number of cases. As of yesterday, I believe, and across the state, there are more than 44,000 confirmed cases and more than 4,000 deaths related to COVID-19, as you can see. On slide 3, fortunately, we have not seen the prevalence of these cases in Livingston County compared to some of the other Southeast Michigan counties. As of yesterday, the county has had 448 cases and 20 deaths. Livingston County hasn't had a particular hot zone as the cases are spread out throughout the county. You know, we believe the governor's stay-at-home order and social distancing helped to slow the spread of this in the Detroit area. I think the other thing in Livingston County is our population density. You know, when you take a look at, you know, Detroit, and you take a look at Wayne County and Oakland County, Macomb County, that population density is much more confined, where ours is much more spread out. I think some of the other things that have impacted this also is, you know, the fact that IHA, as an example, and I know there are others in the county who have reached out from a telehealth perspective to their patients. And I think they're doing a great job of directing their patients. We've had pretty aggressive testing sites up both in Howell and at the East Brighton IHA site. And so we've been able to identify those patients that have symptoms and that we've tested and who might be positive, better able to direct them where to go, whether it's at home in quarantine or coming to us here at Livingston Hospital. And I think the other thing is, and if you've been out and about, I know I've seen the majority, I've seen a lot of the community wearing masks and practicing social and physical distancing. And I think those have contributed to, you know, the lower cases in Livingston County. On slide 4, you know, St. Joe's Livingston continues to care for the community members who have tested positive for COVID-19, and we've been caring for them for 4 to 6 weeks now. However, over the past several weeks, we've also discharged many patients to finish recovering at home and have seen a decline in the number of actual COVID-19 patients coming to us. We've also seen a slowing of the number of cases, just like the rest of the state. Fortunately, even at the peak in Livingston County, we were not seeing numbers like Wayne, Oakland, and Macomb. With fewer cases in Livingston County, it's one more reason to stay local with your healthcare needs, your shopping, and everything else that you're doing. You know, St. Joe's Livingston and the Brighton Health Center are prepared to care for more COVID-19 patients should another spike occur, but we are also moving forward and caring for our community under this new normal. Just because COVID-19 hit doesn't mean the normal healthcare needs stopped arising. So trauma, stroke, and other serious issues have continued. Unfortunately, because of COVID-19, people were afraid to seek care they needed to prevent or care for these issues. St. Joe's, Livingston, and Brighton are prepared to care for both COVID-19 patients and those with regular healthcare needs. Our emergency departments are open, and we have processes in place to keep you safe. So I say this because we are seeing an uptick in home deaths in the county. As a matter of fact, I received data yesterday from Livingston County EMS, and obviously our public health department is very much aware of this, but we have, in the month of April, seen a 287% increase in home deaths. These are patients that, quite frankly, were afraid, they were scared because they were concerned about getting the coronavirus at the hospital. I can assure you that we have taken all of the precautions necessary to keep you safe, to keep COVID-19 patients separate from non-COVID-19 patients, both here and at the Brighton Health Center. So I put that out there, you know, to people that, and I think everyone needs to put this out there. Do not wait. If you need our care, come to see us. Please don't wait. It is, it's leading to some tragedies, unfortunately, in the county because folks are afraid and they are waiting. On slide 6, St. Joe's, Livingston, and Brighton are beginning to reopen services with a phased approach. We're ramping up services in this phased approach to ensure we have enough personal protective equipment and that we keep our patients and our colleagues safe. Just this week, we began doing more essential time-sensitive surgeries in both Livingston and Brighton. These surgeries include cancer surgeries that were okay to postpone for a month or so, but are now more urgent. We also reopened our Brighton Cancer Center on Monday. Previously, patients were traveling to Ann Arbor and Chelsea in an effort to cohort our patients so that we could continue to provide them with the care necessary and to be very efficient with that care as we move forward. We've also begun doing more time-sensitive radiology appointments as well. Over the coming weeks, we will continue to ramp up the number of surgeries and other services. We fully anticipate Governor Whitmer will, hopefully the end of the month, say, okay, I'm going to retract Executive Order 2020-17, and you hospitals can begin doing your elective surgeries again. We have implemented, so you know, many policies and practices to ensure our employees and our patients are kept safe. We know that we need to operate under a new normal to ensure the community receives the care they need. Safety is our top priority. I'll now talk about some of the processes we have in place to ensure your safety. So to keep our patients, vendors, and colleagues safe, St. Joe's, Livingston, and the Brighton Health Center implemented screening checkpoints. Before anyone enters the building, they are screened for symptoms. Our goal is to limit exposure. Colleagues, patients, and vendors receive masks and are asked to sanitize their hands along with a whole litany of screening questions as they are drilled at a few entrances that we still have open. In accordance with the governor's executive order, we do not allow visitors inside Livingston Hospital or the Brighton Health Center. The only exceptions are for patients at the end of life. We also permit visitors for patients in surgery or in the emergency department, but they must wait in their vehicle and we'll call them when the patient is ready. It is important to note that visitors' restrictions reduce the risk of bringing COVID-19 into our building. We do not restrict visitors because we have tons of COVID-19 patients and it is unsafe. We know that some people may not show signs of COVID-19, but are carrying the virus. We don't want to risk the safety of our patients or colleagues. We have developed designated treatment areas for COVID-19 patients or anyone suspected to have it. These areas are far away from other care areas and are labeled to ensure patients or colleagues do not enter them. We ensure patients without COVID-19 are in COVID-free zones. In all areas of our buildings, proper social distancing or physical distancing and masking is required. We have signs and labels on the floor. A hot topic in the news and in our community continues to be testing for COVID-19. Over the past couple of months, testing has improved substantially with increased availability of testing and the turnaround and the associated turnaround time. In most cases, we receive test results within 24 hours. And we recently launched a rapid test that provides results in 15 minutes. This test is ideal for patients entering our emergency room. We also expect continued improvements in testing over time. We know that there is work taking place around the country to develop an antibody test that will tell us if someone previously had COVID-19. This test is a work in progress. I might also note, it's one thing to test an asymptomatic person who may test positive. It's also having the ability to inoculate that person so the virus does not spread. We can test a patient who has absolutely no symptoms today and they could test negative. They could also test positive tomorrow, depending on who they came into contact between now and then and where they were at. So it's very important that we allow our researchers and our experts to continue to develop the vaccines and the ability to inoculate many of these patients that we come in contact with. We right now currently we test every single patient that is that's going to be an inpatient. We test all patients that are showing symptoms. If you are not showing a symptom, we are not testing you right now, primarily because we just don't have available enough tests. Nobody does. It isn't just us, it's everybody. As testing became more available, St. Joe's Livingston opened a drive-through screening and testing site. Community members can drive up and speak with our professionals. If the community member meets criteria for testing, our team completes the test while the person remains in their vehicle. We are also using this testing site for our patients prior to surgery or other procedures. So if you're coming in for surgery, you're going to have to come through our drive-through testing here at Livingston Hospital, and you're going to be tested 48 hours in advance. You're also going to get a rapid test day of. So we are trying to do everything we can to be assured we keep patients in a non-COVID environment in surgery. Another hot topic has been personal protective equipment, also known as PPE. First of all, I want to thank the community for their outpouring of support. We have received many donations of masks, face shields, hand sanitizer, and more. We follow the latest CDC guidelines and are constantly monitoring our supplies. We currently have enough PPE, but conservation methods ensure we have enough for longer periods of time. I'm often asked how the community can help. Thank you for asking, and your commitment is so appreciative. First, I want to emphasize, please don't delay your care, as I mentioned earlier. It is important to be treated before a true emergency. This improves outcomes. And with fewer cases in Livingston County, staying local helps keep you safe. We also can't stress enough the efforts to reduce the spread of the virus. Please practice, and I know you probably have all heard this ad nauseum, diligent hand washing, cover your cough or sneeze, avoid touching your face, avoid crowds, clean and disinfect objects and surfaces, and if you need to go out, please wear a mask. And finally, I want to once again thank you. Livingston County, it's a great place to be. The community has been so generous in donations of supplies, food for our staff, and notes of gratitude and inspiration. If you're interested in continuing to support us, there is a list that we've put on our website. It's a list of supplies that we can accept. And that website is St. Joe's Health, all one word, .org/COVID-19. And we certainly welcome thank you notes for our employees. As a matter of fact, our friends at Corrigan Oil yesterday dropped off 1,000 masks for us. And so it's generosity like that that allows us to continue to provide the care necessary to keep the community healthy, keep the community well, and be safe while we're doing that. So thank you again. I certainly welcome any questions, although I think I'm going to turn it over to Dr. Michael Paulson here to say a few words on behalf of IHA. Michael?
All right, thank you, John. I really just wanted to add some things of what we're kind of doing and how we're dealing with COVID-19 from an outpatient perspective. Like I said, I am the site medical director of our Howell Primary Care Office. And COVID-19 really kind of threw us for a loop. I mean, like John alluded to, I mean, we were changing protocols every hour. I'd tell a staff member how to test somebody for COVID-19, and it would change by the time that test was going out the door. At one point, it was just crazy. But now what we've kind of come up with is we've actually regionalized our sites. So we have our Brighton East, Howell, Hamburg, Pinckney, and South Line clinics all combined into one. And what we have done is this. In our Brighton office, which is right next to the Woodland Center there, the St. Joe's Brighton, we're still seeing patients live. So we have at least 2, if not 3 providers that are there to see patients that need to be seen in person. Also, all of our providers within this regional site were also all performing video visits. So we have that ability, actually using this platform, Zoom, which has been great, as long as people figure out the audio. But I've been generally seeing anywhere from like 10 to 15 patients a day, and we're really able to provide a lot of help using this platform. There are some limitations to it, like for right now, you know, we're really kind of limited as far as what kind of labs we're getting as an outpatient, especially if they're not urgent. You know, obviously we can't take a very good blood pressure reading over Zoom, but we can really facilitate a lot of chronic care management, acute management, a lot of different things. So it's been an invaluable tool, and I'm actually hoping to keep it as part of my practice in the future, because I feel like even from a patient's perspective, it's so much more convenient. You know, you don't have to take time off of work. There's not a long wait in the doctor's waiting room. Generally, I'm actually running on time on a Zoom visit, so that's always great, great things to have. As of right now, we really don't have our plan in place as far as reopening the clinic. I would assume that that's going to be coming together real shortly here, but for right now, I mean, the video visits do seem to be providing a great service. And then anytime I do need somebody seen, we have that Brighton clinic. We also have urgent cares that are still open, and of course, utilizing the ER for anything that is urgent. You know, kind of speaking to John's point, if you do have a medical issue and you're not sure if you should go to the ER, I'd really encourage you to contact your primary care physician's office. If somebody were to call our office today, they will speak to the front staff, who will then either triage you to the triage nurse to see whether you need an appointment versus need to go to the ER or the urgent care. Or if it's not an urgent issue, they'll just put you on my schedule so that I'll be seeing you today. And we have plenty of availability between all of our providers. Just some other resources I want people to know about. If you go to the ihacares.com website, there's an area where you can do a free e-visit online, and this will tell you whether or not you meet the criteria for COVID testing, and they can set you up with an area to get that testing performed. They also would be able to tell you whether you need to be seen at something like an urgent care that we have. There's also a place on this ihacares.com website called Save Your Spot, and you're able to pre-register into our urgent care so it can cut down on your wait time. So those are just some of the things that we're doing at IHA, and I just wanted to make sure that everybody knew about it, and also that we are accepting new patients over Zoom too. So, you know, if you're looking for a primary care doctor and you know, you don't want to take the time to go to the doctor's office, this is the time to do it.
Awesome. Thanks, you guys. I really appreciate it. I mean, you had talked about the whole, what I call virtual doctor. And I think we're seeing a shift overall. John and I were talking about it before we broadcasted live today about this is going to be the way of the future, is how a lot of people that I'm interacting with feel. And why not take advantage of technology and the tools? And I think, you know, from what you were saying, Dr. Paulson, doctors are really open to that, right? And it sounds like are you able to see more patients that way? Is that what I'm understanding?
So my volume has been slightly less than it would be if I was actually in the office, but I think it's really just because most people don't know that we're offering this service as of right now. And as the weeks have gone on, the rate of people I've been seeing has been going up.
Okay. Yeah, I agree with you. I know, John, you had talked about the increase of deaths in the county. And I wanted to just talk about that just for a second, because on this past Tuesday, we did a multi-chamber webinar that was with the fire chiefs and our Livingston County Sheriff Murphy. And they alluded to that they have seen those, their calls, their EMS calls, is because, you know, maybe people are afraid to go to the hospital because they're afraid they're going to get COVID, or they have it and they're waiting to the 11th hour and not making it, or, you know, whatever the situation is. So I'm glad, I guess my point is, I'm glad that you talked about don't be afraid to go to the hospital. And I think it was Chief Plus. He said the same thing. if you're sick, there are, I can't reiterate that enough, and probably you can't either, is just to affirm that from the fire department side was kind of cool, right? That
Yeah.
if you need to go, you can go and don't feel like it's an unsafe atmosphere.
Yeah, Katie, we're working with also Diane McCormick, Livingston County Public Health. The EOC is going to be putting out some messaging here shortly addressing this concern. David Felspot, Livingston County EMS, we just got the data yesterday for April. And, it was confirming our fears clearly that those patients that were dying at home, are patients that, and from what family members indicated, were patients that, they were afraid. They didn't want to come to the hospital for fear of catching the coronavirus. And, I don't have any data to support this statement I'm going to make, but there are a lot of places out in the community today that you probably would have a much better chance of contracting the coronavirus than coming to the hospital, quite frankly. With the way we clean now, with the way we've prepared ourselves and the processes we've put in place, I can tell you the patients coming through to get their labs drawn, to get testing done now, we've spoken to, and they feel very, very comfortable with the screening process, with how we're handling them, how we're keeping them separate, how they're not coming in contact with anyone, except, perhaps one person who has to draw their blood, and they're under full PPE. So, I think we're taking the highest precautions necessary to treat the community. And, we're going to continue to do that. We're hoping that the deaths will go down and that people will start coming back in. The heart failure patients and the like will start coming back in sooner, and trusting that we can care for them like we did before. I think it's, to see the increase in April, quite frankly, the increase in March as well, a slight tick up, but a major tick up in April. So we want to reverse that trend, and the community we really need to, again, build that trust, make sure they understand what our capabilities are. And hopefully they'll start coming to us again so we can help them.
Thank you, John. Appreciate that. So we do have a couple of questions coming in. One of the questions that I had, we talked about, I had pulled up also the recent statistics. You talk about 453 total cases, 20 of those are deaths.